Welcome to Computer Talk's Pharmacy Forward video series. I'm Maggie Lockwood, Director of Production at Computer Talk, and in this three-part program I moderate a panel discussion with Blair Thielemier, Pharm.D, founder of the PharmapreneurAcademy, and Heidi Polek, Strategic Program Manager at DrFirst. We are going to look at the topic, the road ahead, how pharmacy can move from a dispensing-based model to a clinically based one. Blair and Heidi give excellent coaching around implementing pharmacist-inspired programs and how best to use your pharmacy system and communication tools to collaborate with providers and connect with the community. In part one, we will talk about preparing for the journey away from the traditional dispensing model by keying in on topics and trends that are of personal interest. In the second segment, we work through an example of turning a passion into a unique clinical offering. And in the final segment, we talk about building your team as well as implementing technology that support your vision. Both Blair and Heidi are happy to answer any questions, and their contact information is available at the end of the program. Welcome to Computer Talk for the Pharmacist Pharmacy Forward video series. I'm Maggie Lockwood. Talk about the road ahead for pharmacy and pharmacists and how to go from a dispensing model to a clinically based model. So I just, get into this and see where the conversation takes us. The first topic we're going to talk about, what you would suggest as the common stumbling blocks you might see and how pharmacists can get around them or prepare for them, and as far as professional development and resources that are available. And then Heidi, I want to hear from you about the technology standpoint as far as what tools are there that once the pharmacists have laid out a plan to move towards more clinically based outcomes pharmacy practices, how they can track and collaborate with technology. So Blair, why don't you give us some perspective as far as coaching and planning?
Absolutely. So thank you so much for having me. My name is Blair Thielemier. I'm the founder of PharmapreneurAcademy. Basically, we are a coaching, training, e-learning system that helps pharmacists to discover new billing opportunities for pharmacy services. So we look into things like MTM, of course, other billable services with collaborative providers like chronic care management and Incident 2. So we're really all about advancing the profession of pharmacy through billable clinical services and also clinical services that aren't necessarily billable, but maybe they're like a cash pay type service doing like health coaching or functional medicine consulting. So the question was really around how to prepare for even starting this journey. And really, I think what pharmacists need to look at is what are the needs in their community. So there's a lot of opportunities in preventative medicine, since we don't have federal provider status, which hopefully we will have that someday. But even having that, there are things that you can do ahead of getting national provider status that's going to set you up and prepare you for that shift. We all know that dispensing is a hard business to be in with reimbursements and low profit margins and PBMs and all of this. So how can pharmacies prepare to transition or at least generate a new stream of revenue for their store that isn't 100% reliant on dispensing a product? So we're really looking at using the pharmacist's knowledge and things that we can help our patients with. So just to give an example, one of the clients I've worked with, her name's Angela Cates. So she specialized in functional medicine with a focus on gut health. So we all know, we learn in school, your gut is your second brain. What does that actually mean when you're talking to patients who are struggling with anxiety and mental health disorders? A lot of that starts with our diet and starts in the gut, starts with a healthy microbiome. So for her, it's looking at what experiences she's had in her own life helping. And so really just learning as much as she could about that one specific area, and then putting it out there that, hey, I'm a pharmacist. This is what I've done. This is what I can do for my clients. And she kind of was able to hang up her own shingle and say, even outside of a brick and mortar store, can see patients using like a telehealth platform like DrFirst and really make an impact in her patients' lives because she was focused in on niching down and using her background and experience and skill set to the benefit of those around her.
What was the first step for her?
Yeah, so we have something within the Academy called the Beginner's Business Blueprint. So it's really taking that step back and kind of taking an inventory of your skill sets, of your personal stories, of maybe your career background and experiences, of the opportunities in the community around you. So it might be a local community pharmacy who sees a prevalence of HIV in their community, and they're saying, I want to have an impact on HIV. This is something, we've been dispensing these medications and even specialty medications, but I think we can do more. And that's really where a lot of pharmacists say, okay, well, there's so many opportunities. We kind of get stuck in the analysis paralysis, I call it, because we think, okay, I'll do a diabetes program, even though, diabetes, whatever, like it seems like that would capture the most patients. But if you don't have a background, if you don't have interest in that area, then I don't necessarily consider that niching down enough. So with her, we started with, she had a pretty broad umbrella. She knew she wanted to do cash pay. So that would be the first question I would ask. Do you want to deal with insurance? Tell people, even with provider status, you may not be super happy with the reimbursement that you're getting through those codes. So one, you need to figure out, do you want to take insurance or do you want it to be a cash pay service? If it is cash pay, then that gives you a little bit more freedom. So then you start looking at, well, what are my background and experiences? What are the things that I'm interested in? So I've got another client, and she has helped her daughter through alopecia. I've got clients who work with women with PCOS and have struggled to conceive. So fertility issues, it can be microbiome gut health. It can be, a myriad of opportunities just based on your own background. So that would be the second step I would encourage pharmacists to take, to really look and sit down and take an inventory of all the skill sets that they have. And then 3, I would recommend they look at their network. So do you have a collaborative provider that you could work with in your area? Are there other synergistic businesses that it would make sense? So one of my clients is actually seeing patients within a chiropractic office doing genetic testing. So at your network of where are the existing opportunities, where can you find mentorship in some of these things, whether it's functional medicine or it's a collaborative provider, or even just finding someone on LinkedIn who's done the thing that you want to do and reaching out to them.
Well, yeah, and just these ideas, I think that was 3 different pharmacy examples you gave, and they're all really interesting. I mean, the diabetes program or, adherence packaging is something that we've been talking about for a long time, but these ideas, gut health, that's something that you read about, but I would not have thought a pharmacist would be a perfect, that'd be a perfect opportunity for pharmacists, but really it sounds like you could make it work as you look at these new models.
Right. No, I loved everything that Blair said, and I couldn't agree more. So many people were just kind of afraid of making a big change. Well, if you stay with something that something that you've dealt with either in your own personal life, friends, family, et cetera, like the gut health that happened to my mom, that would be an avenue that I would go down. I'm a runner. I love to run. I would think of, doing something in that arena with helping other people that would want to be runners as well. And, as Blair said, it's so important that pharmacies start to move away from that traditional pharmacy pills in a bottle commodity type business model. It's just not working for us anymore. We don't control how much we're paid for those services. Those services can have chargebacks down the road. So, you're in so much more control of your destiny when you branch out into a clinical services model. And in order to do that successfully, you've got to be efficient. You need to meet your patients and your providers where they are. And we're all on the go today. So if you're not using technology in your business like you do in your personal life, I've been thinking about this recently, that we're all so connected technology-wise in our personal life. Yet in our business life, in our healthcare life, we're still using good old telephones and fax machines. I'm not quite sure why we're doing that when there is HIPAA secure ways of communicating so efficiently and meeting your patients wherever they are. DrFirst has a care collaboration platform that will allow you to reach anybody, anywhere, anytime, securely. What a better way to start a clinical service like this than, sharing documents that you need with patients and provider over this platform. You can do pictures, recordings. It has telehealth in it. It's really an all-in-one platform that you can just dial up a number, get a patient, get a doctor. We actually have group telehealth on our sessions. So you could actually have a really great session with a pharmacist, a doctor, a physical therapist, other family members, translators. It's just amazing. And, you can't do that over a telephone call, right? The pandemic is still going on with all the new variants that are still out there. People are still very cautious and not wanting to do a lot of face-to-face meetings. So use the technology that we have out there in order to get these business models up and running.